Do you know that our body consists of 350 joints? Joining two bones move against each other to ensure movement. However, when you have chronic joint pain, your daily activity will be restricted. There's many causes that causes joint pain. They divide into external and internal reasons. The external causes include arthritis, injury, overweight, and overuse of the joint. And the internal factors include aging, rheumatoid arthritis, psoriatic arthritis, and gouty arthritis. When you experience joint pain, what can you do either to prevent or relieve the joint pain? Let me share with you some tips. First of all, you have to remember pain is good. When you have some mild pain, definitely your joint is protecting you from walking. So first, respect the pain. A little bit of pain is good to protect yourself from further harming the joint. Any pain more than 2 hours is considered that the joint has some damage. Taking the painkiller to release the joint pain is a temporary measurement, but too much of painkiller can harm our internal organ, especially kidney. Number 2, you should strengthen your muscle to protect the joint. Strengthen the muscle to protect the joint is important, is part of the physiotherapy during your treatment of joint pain. So range of movement training definitely is important, and you can ask those physiotherapists to teach you the technique how to do muscle strengthening exercise. Number 3, a specific exercise can ensure to maintain the range of movement, because when you have joint pain, definitely your joint will stiff if movement is not there. So you need to ensure that the joint stiffness is always being avoided. So you need to do some exercise to train the range of movement. So when you want to do the range of movement training, you also will need some advice or input from physiotherapists. Number 4, if you want to perform activities, you can always wear a bracer or splint to protect the joint pain. The external bracer or splint can give external stability to the joint that already injured. Number 5, do not carry heavy objects such as a handbag or any furniture. Heavy object can really destroy a joint and cause further joint pain. 6, weight reductions. Scientific reports saying that reduction of 5% of body weight can ease the joint pain. As conclusion, joint pain is very important issues that we need to address. Joint pain can be prevented by weight reductions and all the advices that I told you. However, when you have a chronic joint pain and it was not released by all these methods, please seek medical advice. Further usage of the joint which is in pain will cause more harm to the joint. Do not practice overuse of painkiller to reduce your joint pain. It will harm your joint and also your internal organs. Prevention better than cure. Happy mood, healthy life.
Do you know nowadays joint pain basically is one of the diseases that a lot of people having difficulties, not only elderly but nowadays younger generation, they have joint pain as well. This mainly due to a lot of eating habit, and nowadays the society basically they do not move around frequently. Hence, before you go for any painkiller, is there anything that can help you to relieve the joint pain or maybe can prevent this? Bio-based joint guard basically is one of the few supplements that I recommend to customers. Bio-based joint guard consists of 4 ingredients, which is curcumin, boswellia, devil's claw, and estramel melon fruit extract. This combination of 4 ingredients can reduce the inflammation and pain that people is having. So to reduce the dependence of the painkiller is basically one of our job. Bio-based joint guard is suitable for those who are having knee surgery, elderly, athletes, as well as if let's say you feel that there are actually some joint pain, please do not just simply take the painkiller. You can try this product out first before having any difficulties of walking. And for those that having difficulties in climbing up the stairs, you can try joint guard as well.